Hello, everyone. I'm very happy to have another young Indian with us. He has a very interesting background. He's an engineer who has turned to public policy, public health. He'll tell us more about it. So let's listen to him. Right now, we have with us Shantanu Mishra. Over to you, Shantanu.
Great. Thanks so much, Subodh. I think very spot on with the introduction. I did start off as an engineer. Now I work in public health. So I think just a quick introduction to me. My name is Shantanu. Uh, I'm from Bombay, but I've sort of moved around a little bit because of my education and like the work that I've been involved in. I started off as with my undergrad degree in Milwaukee School of Engineering in the US in biomolecular engineering and psychology. Um, Spent a bit of time uh, doing some field work within the public health space. So looking at setting up makeshift pharmacies in Honduras and Nicaragua. And that was sort of my first, I would say, tryst with what public health looks like and everything that sort of comes under it, which is like wash, nutrition, sanitation. So sort of a very broad field. I graduated in 2017 and I moved back to India and I started working in Delhi post that with Teach for India as an innovation researcher with them. And I've sort of worked primarily on qualitative research with them, looking at how do you support entrepreneurs that are starting their own social education nonprofits. And a lot of my work was looking at ways to support them with how do you do some storytelling, how do you create a business plan, how can sort of people be identified who could mentor them to sort of develop further and scale their enterprises, sort of to make them go past the 5-year mark and sort of be sustainable. I moved to becoming a part of the fellowship itself post that. So with the Teach for India fellowship, I started off teaching maths and science in grade 10th in all girls government school in Delhi in Tughlakabad. And that was sort of my, I think, first sort of experience with the public education system in India and specifically with sort of implementation. So we were implementing the Teach for India intervention, across a couple of different cities. And I was obviously focused on the school in Delhi that I was working with. I think post that, I really moved across to a lot of work in primary data collection for impact evaluations. So RCTs, which were being conducted, creating survey tools and questionnaires for them, and sort of providing training for enumerators and data collectors, and then sort of conducting focus group discussions, in-depth interviews. So spending a lot of time in the field, essentially, in the first couple of years that I was working. And I was working across sectors at that thematic areas at that point of time. So I worked on some projects that were in health, some that were in environment, and sort of I found really interesting how a lot of them were very linked to each other. And I think that sort of deepened really my interest in public health and continuing to pursue that. With that, I think I sort of did a really short stint at an organization that worked in sexual and reproductive health. So it was looking at improving the uptake of sexual reproductive health services by women in India in tier 2 and tier 3 towns. And it was effectively sort of, I was working as a data analyst, so sort of really crunching the numbers, looking at how do you improve the uptake of some services, how can maybe the field staff do a better job at explaining what the services are to people, and sort of figuring out if there are any red flags in the system, if there was any gaming happening in the system. So I think those sort of were my initial years working with data, a lot of work in field research and surveys. And then I sort of moved on to a long-term role with Oxford Policy Management, which was sort of a very pure monitoring and evaluation space. I was working in the public sector governance team, but my primary interest was in health. So I think I sort of cut a deal with them where for 50% of my time I was working on this large-scale health system strengthening project in Bihar, which really looked at building capacity for the public health cadre. So you have your block health managers, medical officers in charge. So basically any facility level staff, and sort of how do you strengthen strengthen facilities that provide primary healthcare services. The other 50% of my time was looking at sort of working directly to provide technical assistance to government departments. So worked in sort of like functional review for the Punjab groundwater department and looking at how do you sort of make the department function more effectively, sort of what are the weaknesses, bottlenecks, and how do you sort of create recommendations out of that to sort of help them deliver better on their mandates. And I think while I was working between these two sort of projects and sort of thematic areas, I really sort of spent a lot of that time, which was 2.5 years, up until I left for my master's in the health system strengthening space. And sort of, I think as once I left Oxford Policy Management and moved on to pursue my master's in public health, I think I was pretty clear that this is the space I want to be in. And I mean, the specific thematic area I was really interested in was health system strengthening. So how do you improve the sort of condition of the facilities that deliver these very essential services to at the last mile in sort of smaller villages, smaller towns. And I think I moved to London for a year to pursue my master's in public health for development. So it was more focused on developing contexts. And I sort of also I had the privilege of receiving the Chevening scholarship from the UK government. So it sort of made it easier for me to sort of be able to obviously go into a really great school, but also to be able to have that financial backing and sort of that sort of security, of being able to fully sort of delve into the curriculum and sort of not have to really worry about, how do I sort of manage the other side of like the finances and everything else. So I think that was quite an incredible opportunity. I think the people that I got to meet through the Chevening sort of network and programs, I think are very interesting. I moved back to India again from London last year in September, October. I moved back to Delhi. And then I think this took me some time to settle back in. And then I started working I wanted to really explore advocacy. I think I worked a lot in sort of policy and research, the research space, the technical assistance space. I think what I really was very interested in seeing is how do you translate all this research that you have and provide it, package it nicely, and give it in the hands of policymakers, because that's effectively when your research can have an effect, down the line. So I think that's something where I'm working at right now. So I'm working with an organization called Partnerships for Impact as a senior program associate currently, which really looks at primarily on the projects of nutrition and health. And it primarily looks at how do you sort of develop advocacy strategies and sort of create consensus around, what are effective ways to maybe, for example, reduce the intake of salt through home cooked food, and how can maybe we develop draft guidelines and how do you and sort of have placed that into the hands of sort of key stakeholders who would then take it to policymakers and sort of push that sort of through. And I think that's the part that's been very interesting to be able to see that there is quite a bit of difference in how the research and the monitoring and evaluation space operates and how advocacy operates, because I do less of research now and I do a lot more of the research that is there. How can I sort of explain that to someone in a very easy way, convert that into like a nice infographic and sort of show them, the statistics that really matter. So I think that whole shift that's been for me from being in a primarily data collection research space to a more advocacy space has been quite interesting. We're about to sort of get on like a longer term project that's going to be working on salt reduction through home cooked food. So looking at strategies around that and sort of how do you crystallize sort of government stakeholders on the issue of that and its linkage with cardiovascular health and the increase in NCDs in India, the burden of it. So I think that's something that's been very interesting and exciting, and sort of to transition from a very implementation role to sort of more research work and now down to advocacy. So I think that sort of briefly been my journey so far.
Mhm.
And yeah, I've been in this role for about, I would say, 6 months now. And it's just been a great learning experience, and I'm obviously excited to sort of work further in these sort of long-term projects in advocacy. So yeah, that's a little bit about me and my journey.
Thank you so much, Shantanu. I think people would be interested in knowing how and why you made the decisions that you made. You made so many decisions, starting with going abroad for engineering. So could you just sort of elaborate on that? And
Great. Yeah, sure.
how you found that place?
Right. I think I was always very interested in chemistry and biology as subjects. Unfortunately, there weren't a lot of courses in India. This was back in 2009-10 when I was sort of graduating from high school. So there weren't, I mean, it was very sort of uh, linear and conventional in what you could choose. So you would either choose a chemical engineering or electrical engineering, but there were very few things that were sort of at the intersection of both. Biotechnology was really starting off at that point of time. It was like a new topic. This is about 10 years back almost. So I think some of my decisions were purely driven by the fact, which was I started off actually. Um, I spent 2 years in Manipal University, right after my high school, doing 2 years of actually chemical engineering. And I think 2 years down the line, I realized this is definitely not it for me. It had very little chemistry, almost no biology. So I think at that point of time, I realized while I've spent like 2 years of my life like on this, I don't see myself like going any further with this. The good part was that sort of the course that I was enrolled in expected us to spend 2 years in India at Manipal and then 2 years abroad. So eventually your degree would sort of be given to you by by the university that you sort of transferred to, and that could be anywhere in the US, in the UK, Australia. I think US was sort of a natural choice because there was so much sort of cutting edge research being done in the field, in the space of biotechnology. And I found this really sort of interesting mm, major called biomolecular engineering. And so I sort of went through the curriculum of it, and it actually sounded like something exactly that I wanted to do. It had a little bit of chemistry, it had a little bit of biology, and it was sort of at the mix of it, but with engineering bent to it. And I think I found that really interesting. So I sort of switched, at the end of those 2 years. So actually, when I moved to the US, I was already 2 years into my engineering in India. And I decided at the end of those 2 years that I was going to start over. So actually, my entire journey of, I think, engineering has been 2 years of chemical engineering, then 4 years of biomolecular engineering, and then I sort of did an extra year for psychology because that was something of interest. So it's been a little non-conventional, I think, in how I sort of reach at the decision of get into it. But I think a lot of it had to be attributed to the fact that the kind of courses I was looking for were not available in India at that point
Yeah.
of time. Obviously, right now there's a lot more options and flexibility. I think that's sort of how my choices sort of led me to the biomolecular engineering space.
Okay. And then to go to Central America?
Yeah, so I think that was just I think it was just like it was something very unplanned and unexpected for me. I think it was an organization called Global Brigades, which basically would it was public health volunteering, and they would take a bunch of nursing students. They would take a couple of engineering students down to um, three different countries every year in spring break, so around the time of March. And The first year I sort of didn't really know of it, so I didn't apply for it. So they went to Panama the first year, but the second year I think we started hearing a lot more about how people had a great experience there, and they got to learn a lot more about how implementing something like this and volunteering in public health looks like on ground. So I applied for it the next year. There was like a structured course around it. So we had to learn some basic Spanish, words that would be used to sort of some sort of how would you refer to some kind of medications in Spanish, or some activities or actions that you would do very often. So sort of to make it a little bit easier and sort of to reduce the language barrier a little bit. So I think that was really interesting. So the first year we went to Honduras, which was really interesting experience because we were um, I think there's this whole perception around Honduras, with there being, the violent crime being incredibly high and being sort of a relatively not very safe or a stable place. I think my first experience of like sort of being picked up at the airport, like a group of 20 of us, but there were like sort of armed guards like around us. So it was a very
Yeah.
eye-opening experience, and it almost I think a lot of stuff that you read became very real for me. I could see it for myself. But then I think the experiences of interacting with people that were living in the communities there, I think when we sort of established these makeshift camps out there, was really nice. But it also showed the depths of sort of inefficiencies in the public health system there, and at how many people just lacked access to basic medications like paracetamol, like maybe an ibuprofen. So, it was 6 or 7 day sort of the entire project. We would sort of get up every morning at like 4 a.m., 5 a.m., be like a 2.5 hour drive up in the mountains. We'd be by this sort of school, which was converted into a pharmacy while we were there. So we would sort of have these different stations. There was like a hand wash station. There was a station for some screening, basic screening. There was a dental services station. And I was working in the makeshift pharmacy. So my whole job was to ensure that the prescriptions were filled on time and we could get out as many prescriptions as possible in a day. So I think that was really interesting. I think just experiencing a different culture, which was like halfway across the world from where I was born and raised in, I think was very exciting and interesting. But it also sort of really gave me perspective into, I mean, in India, I've had the privilege of not having had to interact a lot with the government public health system. I think that wasn't, and so I think a lot of my experiences were with the private sector, and that tends to usually work relatively efficiently compared to the public health system in India. So I think to be able to see that probably like a three-fourths of the population is dependent on public health services being accessible, and I think how important that was, I think really sort of gave me sort of some direction in terms of where I wanted to move forward. And so that was the whole experience, I think, with volunteering in Central America.
Okay. And how did you find studying at London? I mean, that's your third country. That's your third country in education. How was it?
I think it was different from it was very accelerated because effectively you spend 9 months in
Yeah.
school, you 3 months writing a thesis, and UK masters are 1 year.
Yeah.
Usually the US masters are longer for 2 years. Even the engineering degrees are shorter. They're about
Yeah.
3 years. I think I'm glad I went there probably after 5 or 6 years of working, because I think it would have been difficult for me to cope with the sort of how self-driven the courses are. I think in my undergrad, I needed a lot more guidance. I think at London School, while there was guidance, you're also sort of expected to make a lot of decisions for yourself and the modules you want to choose. Do you want to build skill sets in qualitative work, quantitative work? So I think having that freedom to choose was great, but it was also confusing at times, I think. So I think we really heavily relied on, we had a very small class, about 23 people. The broader public health course was about 150, 170 people. And ours was a very international, a very global classroom. There were 24 of us. I think half of us had scholarships of some kind. So I think it was also a very rich classroom that we were able to be in. Everyone had come in with probably 5 to 10 years of work experience. So I think just be able to hear perspectives from like 12 different countries within the same classroom, I think was incredible. I think that is something I did not get in my undergrad. So I think, because also I was in a much smaller city in the US, Milwaukee, sort of, a lot of people don't really know where it is. So I think for London, I think being able to have the multicultural experience, but also being able to be in a classroom with so many incredible people that have really done, like doctors from Malawi. So for example, we had people that were economists and lecturers at Princeton who had sort of just decided to gift themselves 1 year of masters, after many years of working. So I think it was just incredible to just see so many different people from so many different contexts and backgrounds. And I think that I really do value at my time at London School. Yeah. And obviously, the city is incredible. So I think just getting to explore London was the cherry on the top for the whole experience.
All right. What else do you want to tell us?
I think just I'm just cute. I mean, I sort of um obviously, like, while I have an interest in health system strengthening, I think a lot of the work that I see myself doing in the future, like probably like 5, 6 years down the line, I think has to do with probably more with more marginalized communities. So I think while health system strengthening at the core is that the focus that I always have, I think what I do want to work down the line is more with the LGBT plus community, specifically the trans community in India. So I think that for me is sort of opportunities in that space, while they do exist, are not the best paid and also are not the most visible. So I think to be able to create like and be able to help build an ecosystem for something like that, where you can work a little bit more with more voices in communities that are not really heard or even considered when you're designing health systems, I think would be something that I see myself exploring in some time. I think right now, obviously, I'm sort of uh, experimenting with different paths within the development sector. So like I've moved from, implementation to research to now advocacy. But I think at the end where I see myself is probably working within that space when we strengthen the funding around the work with key populations, for example, in providing primary healthcare services. And there's quite a lot of work that the Indian government has done specifically within for the trans community. So I think that's sort of an entry point that I'm looking to explore in some time. Because there is some sort of foundation to it that's already been laid, I think. So I think that is something that I'm exploring. I'm seeing what are the places I can be. And, as I'm talking to people now in networking, I'm also able to understand that, what are the kind of skill sets that people value when you want to move to a space like that. So I think, being able to have an understanding of that would be quite helpful. And that's sort of like the long-term goal that I'm looking at, I think, within health systems.
Okay, good enough. What kind of tips would you have for younger people?
Right. I think I would mostly I think what I've done is I've sort of tried as much as possible to explore a lot of different things. Some, not all the time, do you have, I would say, the ability and sort of the time to be able to do that. So sometimes it's very linear for some people. You have to finish your degree in a couple of years, you have to move on, get a job, everything else. But I think every time that you do get a chance, I think that will be my first thing, is that do try to explore as many different little things as possible. And you don't have to do, you don't have to go all in for each of those things. But I think we will to get a taste of a couple of different things, and then figuring out what it is that you'd like and you don't like. I think it really helps you down the line, I think, a couple of years in deciding, okay, this is what I do want to spend sort of my career in. I think that'll be the first thing. I think second thing would be just really intentional, like, networking. But I think that's the way that people do it sometimes can seem disingenuous. So I think finding your own way to do that, in which it is like as organic as possible. So you sort of develop and build relationships over time with people. You do that through your work. So I think everywhere you go, I think even from people that you might not uh, might not necessarily really get along really well within your professional space, there is still something to learn from there for yourself. So I think I would see even sort of the setbacks as something where I've had like a learning thing, because if something's not worked out, like for example, if I've not gotten along well with someone, it's also taught me how do I sort of approach this in the future post that. So I think in the moment you sort of see it for what it is, but on a broader level, there's a learning around that. So I think just being open to the fact that, if even something's not working out, there's something that I can learn from this and sort of, ensure this doesn't happen in the future for me again. And I think thirdly, I would just see that, I think in terms of for people that would be interested in pursuing master's degrees, for example. So any higher level degrees, I think I found that when you wait for a few years after your undergrad, so you get some work experience, you get a sense of what the sector that you're interested in looks like, what are the skills people value, you get so much more out of your master's degree. So, you know, there's a lot of people that are just transition straight from undergrad to their postgrad degrees. My sort of tip would be to wait a few years, sense the sector out, get some, you know, professional working experience, and, you know, learn how to deal and navigate with like work complexities of work, and then sort of, you know, bring all that experience into a classroom when you choose to apply for a master's degree, I think. So waiting it out a little bit, I think, between that space. I think for me, I mean, my brother, for example, chose to go right after his undergrad, and I think his experience was a little bit different than mine. And I think so that would be sort of like the third thing that I would definitely sort
Well,
of
thank you
like to
so
say.
much. I think we can end this here today, right?
Yeah, great.
All right, so let's say bye to the viewers. I'll be back with another young person or an expert soon. Bye till then. Bye, everybody.
Thank you.